and hate that video all at the same time. I don't think I should use the word hate when I'm in church, but I think it does a good job. Go ahead to the next slide. Though I work for Columbus Public Health, I'm super loud, so do I have to? Can you guys hear me if I'm right here? So I work for, I'm sorry. Got it. If I could turn back time. So I work for Columbus Public Health, but what I do at Columbus Public Health is I oversee the Addiction Services Division. Within that division, we have prevention, where we do a lot of stuff in the school districts throughout the city and county. And I also oversee the medication-assisted treatment clinic, which is Suboxone and Vivitrol. And then I also oversee the treatment component, which is outpatient, as well as intensive outpatient, outpatient. We link to a lot of services, including those that are up here and in the community. But I'm also charged with overseeing the Columbus and Franklin County Addiction Plan. Within our community, when I first got into this position, we were calling it the Opiate Action Plan, right? The problem is we are no longer just dealing with opiates. We have an overdose epidemic, not an opiate epidemic. It just so happens that in 82% of the overdoses, there's fentanyl. But I can assure you that of those people who've overdosed on fentanyl, the overwhelming majority did not think they were using fentanyl or heroin. They ordered egg salad and they got roast beef, if you understand what I'm saying by that. Okay, go ahead to the next slide. So I like to tell you, as a plan, this is what we want to do. We want to decrease the number of overdoses in the county. Just decrease the overdoses. And the numbers have gone up and down and people play with it. But the bottom line is, in the state of Ohio, we are number 2 in the nation in overdose deaths. Number 2 in the nation. We are not number 2 in landmass. We are not number 2 in population. So that number should startle you. Franklin County is actually one of the highest. And people are like, oh, that's because it's a major city. Well, Scioto's also been really high, and it's actually pretty small. That's Portsmouth. It really has to do with where we're located in the intersects of major freeways and drug trafficking, okay? So go to the next slide. So what we're doing is we're looking at decreasing the overdoses annually and decreasing the overdose deaths. Last year we had 804 deaths. There's a delay in terms of the amount of time when we get the actual report. But when we say they were 804 deaths, to some folk that's like, oh, we're a population of like 1.3 million. Is that really a lot? It's a lot to the person who lost their child. It's a lot to the person who lost their best friend or their aunt or uncle. We like to say that every life matters. And when people, we get challenged with, and I'm sure they'll come up and talk about it, this is the EMS runs. We've had folks say, well, how many times should we go to a house and save somebody from an overdose? Well, you only die once, right? So I'll go as many times as it takes. We never have that conversation when we talk about a person who has high blood pressure, is overweight, continues to drink and smoke, and the ambulance has been to their house 2 and 3 times. We never throw back, well, how many times are you going to save that heart attack victim? We're here to serve and to protect, not based upon the disease or based upon the person, but just what we're charged with doing. So what you see here is last year, and this is somewhat deceptive. It looks like, hey, we did pretty good last year in terms of the number of people who went to the ER, right? So we went from 5,775 to 5,826. That was from 19 to 20. But here's the reason why. Do you remember that thing called COVID, where we were telling people don't go to the ER? Even the person who overdosed said, I won't go to the ER. I don't want to clog it up. I don't want to cause anyone else to lose a bed. And so that's why we think those numbers were low. This is where we were. These numbers were pulled, and it says it down in the bottom. These were numbers that we ran through July. So we were already at 3,065. So I do expect that number to go up to probably about 6,700 runs. Go ahead. Now, hepatitis C, the reason we talk about infectious disease, COVID included, is because hepatitis C is one of those diagnoses that we can directly relate to injection drug use. We can relate to drug use, period, and cleanliness of tools or kits that people use. But we don't only look at this is what we report out on, but we also look at HIV. I'm not sure if many know this, but I feel like we need to talk about it. We still have a syphilis epidemic in Ohio. Syphilis. I just had to get a referral today from a woman who has syphilis in her eye, where she's got a PICC line in her eye. Guess what? There's no recovery place that's going to treat her. None. She's seen as a pariah. Next slide. So why is this important? When we have this plan, it's saying that we across the county and city are going to approach this in a unified manner. It's how you address any disease. It's how we've done COVID. When we work with Franklin County Public Health, we don't say, oh, well, you guys only deal with Hilliard, you guys only deal with Columbus, and you guys only deal with Reynoldsburg. What we say is, okay, here are the resources that we have available. How should we go about attacking this issue? Who's going to set up the clinics to give vaccines? Who's going to set up the clinics to do testing? It's very much the same when we came up with this plan. So when I was called by Ms. Schiff and she said, hey, can you give out Narcan? I'm like, ooh, our allotment is tight. Let me call over to Franklin County Public Health. And they said, yep, we're on it. We utilize and maximize the resources in the community because we see numbers and surges that tell us, yes, we still have a COVID pandemic. What's really unfortunate is we've never left this overdose epidemic. And we feel, and I'm saying this as an employee in this field, we feel a little bit slighted. Not to say one life is more important than the other, but we hope that the work that we did for the past several years didn't stop. So this is to tell you what a surge is. So when a surge occurs, actually you can just look at these folk on the panel. What we do is I get a phone call. It can be from all of the ERs, one of the ERs, emergency departments. It can be from the Franklin County Coroner, or it can be from one of these agencies sitting up here that says, hey, we got a bad batch of dope on the street and we had 10 people overdose. This has actually happened. I believe in Whitehall, the last time it happened, there were 7 overdoses, 4 of which all happened in the same house. Do we have an issue? Yep. So what I do is call out and say, hey, what does your intel tell you? What's your insight? Any information on the ERs? Are they responding to Narcan? So once they tell me what the response is, we determine, do we need to have a phone call, send out an outreach crew, of which we always need volunteers. Excuse me, do we send out an email? Do we do social media messaging? So you can tell the change. There was a 40% increase in mental health and substance use in America, according to the research that was done by the Substance Abuse Administration. So since COVID, more people are drinking, more people are taking risky behavior of smoking marijuana from people they didn't know who grew it, and we don't judge what they do, we just say we want you to test it. That shows you the numbers nearly doubled in terms of overdose surges that occurred. We also have the epicenter report, that's the ER, the coroner report. SOAR is, you can get a phone app, and I'll share this with you later at the closing, but it's an app that tells us if I'm somebody on the street who's using, and I use, and he comes to save my life, and I say, Lieutenant, I'm gonna tell you where I got this, but they told me that I was getting perk 30s, and Lieutenant says, there's no perk 30 in this is all fentanyl. So we send out an alert to the people so that they know if you're buying from this particular area, chances are it's dirty. Now, for some people, that's a challenge. Go to the next slides, please. For some people, that's a challenge, but this is the reason we do it. This is the number of overdoses in the blue. These are the number of overdoses that we've had each week since January. And in the red is the number of overdose deaths. You can see that one week we had 130, I think it was 120 overdoses in April. And then you see the number of deaths. So again, we look at harm reduction. I want to make sure that no one dies. And so giving information is allowing them to make an informed decision. The next slide. This is why when I talk to Schiff and what have you, they're like, can you bring that map? Because there are some folk who don't think that Grove City has a problem or that fat meets greasy. These guys actually know exactly the locations. What you have here in this lower, you see where Grove City is? That isn't just one overdose, by the way. That means that multiple overdoses occurred within that hexagon and that we had a response to it. Where you see the red may be like going above the number 5 as the baseline. We had 10 overdoses or 15 overdoses in the week within this area. So this is Grove City down here. And every week I send this out because we look at the trends and patterns across the county to see who's overdosing, where they're overdosing. But then the next step is we give it to law enforcement because it helps them with the interdiction side. Go ahead. Again, this is another map. You can see Grove City. And I don't know if you can really look at that or cue in on it, but the reality is there are like 3 or 4 hot spots within Grove City. They know where the hot spots are. They're not going to tell you yet, though. Go ahead. So here's the things that we can do. Again, we'll send out an alert to the community. You can sign up for the Columbus and Franklin County Addiction page, and that's our Facebook page, and we put out alerts, and it'll clearly say Community Overdose Alert. Or we'll just put out messaging, hey, we're having a training in Grove City. We'd like you to come and participate. Or the thing that we're doing for faith and community. Pastor, where'd Pastor go? Hey, Pastor, we're doing this thing called recovery congregations, which sees this as the disease that it is, not a moral failing. And if you're a recovery congregation, you get a sign and a plaque out front so that if a person says, you know what, I'm tired, they get to come in here and your staff and your folk will be trained on it. So we're doing that on the 17th, next Saturday. The other thing we do is the emergency pop-up Narcan event. Can you go to the next slide, please? And this is to tell you how many of these we had. Those emergency Narcan pop-ups, we had 13 of those last year. What that tells you is we had 13 surges in the community where there were deadly batches of drugs on the street, and we wanted to get into the community to say, have Narcan on hand. The other was the alerts that we sent out, and we had one emergency call, and that was when it was like a 72-hour period of, I won't say what we were saying, but it was like, what in the heck is going on? And we ended up having all of the partners have conversations and say, this is what we're going to do. What are you going to do? Oh, the REACT team is going to go out. Oh, Madison Township is going to do this and this. Go ahead. Here are the messages that we put out. Again, that community overdose advisory will go up on social media, but we also talk about if you suspect somebody's overdosing, call 911. If you don't have Narcan, you still call 911. You probably know of the Good Samaritan law with regard to prosecution, which Judge Thomas probably knows better about, but you're not going to be prosecuted. It's saying somebody's in my presence who's overdosing and they need help. And we ask that you don't clean the scene or do anything else, just call 911. The other is to make sure that you're giving CPR if you are able. If you don't feel comfortable, we get that. Go ahead. And these are some of the other signs that we put out and messages that we put out to the community. How do you respond to an overdose? And then on the right, this was something that came from a former coworker that said, we have an increase in meth use, especially in the Victorian Village and campus area. And a lot of times folk will be like, oh, well, meth is fine because it's not opiates, it's not heroin. My statement is there is no safe drug. There is no safe drug. If 82% of the deaths have fentanyl, but 82% of the people did not seek fentanyl, that tells you the drugs are being stepped on. So what we also do, next slide please, is hand out fentanyl test strips. Test your drugs. People are like, well, you're giving them permission. No, what I want them to do is make an informed decision about whether they want to roll the dice with their life or not. And then notify other people who are on hand to respond if necessary. And again, the pop-up events to identify trends and the emails with action steps. If I send out an email, I'm not just going, hey, there's a problem. Hey, there's a problem. Can you do this? Can you post it on your Facebook? Can you tell your kids to tell their friends? Can you check in? Whatever it needs to be. Go ahead. Here's one of the pop-up events that we had on September 2nd, which is International Overdose Awareness. We actually had a major event. It was August 30th. We did amazing across this county and collaborated with different folk who are up here as well. Alrighty? And we also do what's called the walk-in for recovery. So what we found is for a lot of individuals, how many of you here actually have somebody in your family who's abusing drugs that you know of? Right. So sometimes they've been so far out of it, there is no such thing as rehabilitation because I haven't been habilitated. I don't remember how to get a job. I don't remember how to fill out it. People were worried that they were going to misuse their stimulus. You know, you can't get a stimulus check if you don't have a ID. Do you know how many folk don't have ID who are using substances? So one of the things we set up was, let's do a clinic where you walk in and at base, the basic thing, let's break bread. We're going to offer you food and water. If any, that's it. And if you say, well, that's all I want, okay, I just want you to know we have some test strips and some Narcan. If you want, no push. And as you're walking out the door, oh, by the way, we have a mobile medical unit here who will do some STD testing as well as your vaccine. Oh, did we mention that you get a $100 vaccine card? And immediately people, you know what their response was? We dehumanize them, right? Well, they're just going to use that on drugs. I don't know that. I know that they came in and they ate that food and that they were hungry and that they're saying they want support and help. And then we have a bunch of treatment agencies that are around and we say, how can we help you? The walk-in for recovery, we did it at Jordan's Crossing. We had like 7 or 8 different locations. We served this year double the amount we've served in the 2 previous years. We served close to 740 people, getting them birth certificates, IDs, and then the best part, 40 of them went directly into treatment. I'm not going to go to treatment unless I have a relationship with you, unless I can develop rapport with you. And so these events are simply to develop rapport and trust. Go ahead. This again tells you the numbers. Green is this year in terms of what we were able to produce, giving out Narcan. Wound care, which is very common. Wound care is a major issue. We're not just talking about MRSA. We're also talking about endocarditis, open wounds, broken limbs. We were serving those individuals as well. Go ahead. This is my information. My time is up. I'll close with a little bit of a positive energy thing because just the fact that you guys are here makes a huge difference in this community. Thank you so much for your time and your attention. I hope I can give you more of that at the end of this. Thank you.
Thank you.